New videos every day.
Okay, so I'm John Breeding, here on behalf of the Coalition for the Abolition of Electroshock in Texas today. That's endofshock.com is our website. I want to introduce two of my favorite coalition members. Evelyn Scoggin, 49-year-old electroshock survivor. Shocked 31 times at least at Seton Shoal Creek Hospital between January and June of 2005. Also on screen with her is her sister Kathy Scoggin, who has become an ardent activist for our effort to abolish electroshock in Texas. Please listen very closely to these two remarkable women, and then I'll have a little commentary after their interview. Evelyn was honored last week at our 5th annual Rocky Erickson Ice Cream Social Rock to Band Shock concert celebrating electroshock survivors. You can read all about that on our website. And Kathy has been a great activist and is featured in some of our materials for our electroshock protest rallies at Seton Shoal Creek Hospital here in Austin.
My name is Evelyn Scoggin, and I'm a ECT survivor. So far in my charts, we have found that I've had 34 ECT treatments, and this is my story. In September of 2004, I walked into my bathroom one night and took a bottle of chlortrimetine. They rushed me to the hospital and fed me charcoal, and then took me to Shoal Creek. I had never been to a psychiatric hospital before, and I was a bit terrified. I didn't know what they were going to do or what it would look like. But about 4 o'clock in the morning, they finally got me all registered and let me go up to the floor, and it was much calmer than I thought it would be. But each day we would have different kinds of therapy, and one of them we would have would be a group talk therapy, which they finally had to pull me out of because they said I was too empathetic. I would start crying halfway through the group because I was feeling so much of their pain as well as my own. So my doctor changed me out. I don't know how many different pills that I took before he got it on a kind of even keel. And during all that time, I was taking, I'd stay in the hospital 5 or 10 days, and then I would take ECT outpatient from 10 to 15 treatments. Both my sisters told me that before I did ECT therapy, that they're supposed to give you a form to fill out that's called informed consent, which means that they tell you what they're going to do, you understand what they're going to do, and then you sign your name to it, showing that indeed you know what's going on. Well, during and after all the treatments, both my sisters and friends and whatnot told me they were there when I signed the forms, and they said, some of them said they begged me not to take any more of them, but I don't have any recall of any of that. They said I signed all the forms, but I have no recall of any of that. So, if I don't have any recall, I don't know how that can be informed consent. I didn't know that I could stop taking ECT anytime I wanted. I thought that once my doctor told me I had to go and do that, I had to go and do it for as long as he said. And I started feeling really scared about going. I felt like at some point that something was going to happen to me that was disastrous. So I've talked to Catherine, and she said, the doctor said you could stop any time. I said, really? I didn't remember that. She said, yes. So I called the doctor on the phone, and he said, yes, you can stop anytime you want. And I told him, well, then let's stop. I don't want it anymore. I continued seeing him outpatient and, going through different kinds of drug therapies till I'm kind of on an even keel, but still I feel like, too much drug therapy. I'm taking 7 different kinds of pills. I'm on SSDI and Medicare, and they don't pay all of my medicines, and my medicines cost, about $2,000 a month. Before I kind of lost it, I was a teacher at TSD, the School for the Deaf, and I worked with their special needs students. And I don't know, but I guess between the administration and parents and the students I was taking care of, which were no small feat itself. I guess I just felt like I was overwhelmed, and I guess I didn't even realize it. Didn't completely realize it until I took the pills, and then I was like, oh yeah.
My name's Catherine Scoggin, and I'm Evelyn's older sister. She lives with now. Prior to all this psychiatric problems, Evelyn was a reasonably normal, stable person who's had her trials and tribulations like everybody else, handled a very stressful job and everything that life hands at her without having to take medication or any psychiatric therapy. And then with one episode of depression and being admitted maybe a couple of times before giving the medication time enough to do its job, that's maybe on the second or third admission, the doctor suggested, let's just start doing electroshock therapy. I wasn't there to say, hey, let's wait a minute. They just started doing it.
Did you tell them why? You're a nurse?
Oh, I'm a nurse also. But then after it started, getting it stopped was very hard, especially after when I started seeing the huge memory losses that she was having and physically becoming more and more disabled, unable to care for herself. That's when I said, we've got to stop this. And it took getting her scared enough to say no, because we didn't have power of attorney or nothing. And after the fact, you really can't get a power of attorney. When I knew what they were doing to her, and I knew what the end results was, but I knew my hands were tied at that point. And if I could tell anybody anything, get power of attorney. It's so easy. If you do nothing else but write it on a piece of paper with your family member, if such and such happens to me, then you have the right to sign medical consent. Go have it notarized. Put it somewhere safe so you'll have it available. Because I don't care how young you are, it can happen. I've seen more people damaged by this electroshock therapy than I've ever seen helped with it. The first time I saw electroshock therapy was in 1975 when I was in nursing school, and I was appalled by it and had not seen it since then because I had not been in psychiatry. And when I came down here to see my sister and help take care of her, and I saw that they were doing it, I was appalled that here we are in the 21st century and we still have to use this ancient barbaric torture to help people, supposedly. And I think it's just a means of getting all that they can out of the insurance and these helpless people, and it needs to stop. There's two other means of treatment.
My opinion of ECT is that it's almost like it kills the person that was there. At least that's my perspective, and a lot of people that I met, that's theirs as well. That the person that was in there before the electric shock is not exactly the same person that comes out on the other side. They have lost a lot of memories. They have lost a lot of abilities to do things. I have the problem of being in big groups, and I tend to be be solitary, not go around other people. So that's kind of what happened to me. That I think that's the experience that most people would have. What ECT did to me was well, even after I finished all the treatments, I didn't realize how much it had changed me until probably 6 or 7 months later. I started realizing that I had lost a lot of things. Like I'll be talking about something, and in the middle of talking about it, it's gone. And I just can't find it. It's not there. Or a word that I need that I'm trying to put in a sentence is not there. It's very frustrating. And I've had to start walking with a cane because I had arthritis before, but I get very clumsy and I fall a lot. And I've done other things around the house where I'm cooking or whatever, and I'll burn myself by accident or things.
Sleepwalking.
Oh, yeah, and some of the medicines I'm on make me sleepwalk, and I've done some weird things while sleepwalking. So, and I'm not the same Evelyn I was before. The memory loss is funny. It's really funny because, and I think this may be why my sister and her friend don't see it the same way we do, is that I'll remember some things and other things I just won't remember, and it's kind of funny. Like, I'll remember stuff from lines from a movie, and I can't remember what I did yesterday or what today is. The date is, what day it is, I'll lose a whole week where I don't remember any of what happened the whole week. So, so that's.
Have you lost childhood memories?
Oh, I've lost many childhood memories. And she'll tell me, no. Oh, one of the biggest things that I have lost is my ability to, not necessarily know directions, but to be able to get around anywhere. I can't drive anymore for one thing because my medicine makes me I can't concentrate on everything at the same time. I can only concentrate on one thing at a time, and so I'll run over the curb over here or something over here, and that won't do. So, but the other thing is, I can never remember from 1 minute to the next where I'm supposed to go, to some place, even if it's some place I've been many times. I sometimes will forget, no, it's this way and not that way, and that's really been very frustrating, because, well, I have a therapy dog, and she helps me when I take her outside, and I try to go in the wrong apartment or something, and she'll tell me, no, this is the right apartment down here, and So I always have to have help with something about getting around. And if I have to ride the bus, I have to write down all the numbers carefully because I write numbers backwards and words back. I'll even write down whole different words that weren't there. Like instead of good, I'll write apple. It's like, where did that come from? These problems started after my psychiatric treatment started, and it seems to me they've just gotten worse.
The memory thing, her clumsiness definitely has gotten worse, being very weak. Her, at times, her antisocialism gets worse, and she just wants to stay home and do nothing, which that wasn't Evelyn before. She had tons of friends and wanted to go places. And now it's an act of Congress to get Evelyn out of the house, bless her heart. She wants to, she's just scared to, because when she gets in a situation with new people, she feels, I think she feels out of control, so she don't want to put herself in that position. And so it's hard.
Last Thursday they had a ice cream social with lots of good music at the Threadgills on
Riverside.
Thank you. And my sister really insisted that I came, and I'm glad that I did, even though I'm kind of a bit claustrophobic, because I really enjoyed myself. And they had us sing on the stage and do all kinds of things I didn't think that I would do, but I did, and I really enjoyed myself.
What did you think about all the people that were there and talking to you and the support?
Oh, yeah. I didn't think that there was even that many people that knew about it or that many people that had ECT therapy, and it blew me away. It really did. It blew me away.
I was at the ice cream social also, and the support and outpouring of the love and of the community was just overwhelming, and overwhelming not for me to have Evelyn understand that she's not in this by herself. There's a whole community of people out there, and we're not just speaking out just for Evelyn. We're speaking out for this whole community and the whole community of people who may get caught up in this one day, and to know that there's people out there who's been through this, and we're going to help you through this, and maybe one day we can stop it.
Okay, John Breeding here again, and you've just seen and heard two very sincere, very real women from Austin, Texas, sisters who went through an incredible ordeal together and still are going through that ordeal together. Evelyn Scoggin went 47 years with absolutely no contact with psychiatry. As she said, she worked as a teacher at the Texas School for the Deaf, had an active social life, gregarious, enjoyable person. Summer of 2004, she started having a hard time, had some surgery with her foot, having some other physical problems, got kind of blue. What happened? Her general practitioner prescribed Paxil. It's hard to reconstruct, and Evelyn's memory is mostly erased from that period. Did she have a bad reaction to the Paxil? Very, very possible. I don't know. But in any event, as she said, she took a bottle of chlormetron, not going to kill her, but made her sick, and ended up at the hospital, and then was admitted for the first time in September '04 to Seton Shoal Creek Hospital. In fact, less than 2 years later, she'd had a whole series of various polypharmac drug treatments. a series of at least 31 electroshock treatments between January and June of '05. Discharged for the last time from Shoal Creek Hospital, now on Social Security disability, unable to work, having a hard time functioning, still on polypharmac drug treatment. And you heard her story of the various effects of those treatments. Evelyn's case is a very clear and unfortunately all too common indictment of modern-day biological psychiatry. A person has the hard time in life, go immediately to an SSRI drug, then go immediately to more drugs, and then, as Evelyn said, a series of various combinations of pills, and in and out of Shoal Creek for 3 months in the fall of 2004. And then within just a little over 3 months past her initial interface with psychiatry with Shoal Creek, they're already wanting her to do electroshock. And as she makes in her statement today, and as she stated from the stage at our concert last week, she doesn't even remember the informed consent. We know she was on all kinds of drugs. It makes a sham of authentic informed consent around psychiatric treatment, specifically electroshock. But in any event, it shows how quickly that hospital and psychiatry in general is to resort to intensive brain damaging treatment like electroshock as soon as the drugs don't seem to get the desired effect, or as soon as the drugs create more chaos and confusion and disorder and despair in the individual, which is what happened to Evelyn. Did you hear, by the way, what she was saying about her initial experiences at Shoal Creek? That they had some other programs. They had talk group therapy, for example. Evelyn was too empathetic. She was crying too much. That's some sort of pathology? Give me a break. It's a huge misunderstanding. Crying is an emotional healing. Crying is a form of emotional discharge. It's not a symptom of too much anything. The problem is that the hospital does not understand that she just needed to be facilitated and allowed to cry as much as she needed to cry. That's a healing process. All too often it's interpreted as a symptom of pathology. In her case, it was interpreted as something to move her out of an arena that was maybe helping her. Those arenas are very secondary because the main and primary treatment of psychiatry is, of course, the drugs. Evelyn got antidepressants, stimulants, mood stabilizers, sleeping medication, and antipsychotic drugs. Unbelievable. And then electroshock on top of that. The only reason the electroshock ended, you heard the story from Evelyn and Kathy. She finally was told by Kathy that, you could stop. And she talked to the doctor and says, okay, you can stop. How many would they have given her? We have a quote in the Electroshock Quotationary, Leonard Roy Frank's book, on our website. It's by a doctor named Viscott. It says, it seems like the main indicator for electroshock treatment is whether the patient has insurance or not. Evelyn apparently had some pretty good coverage and may have continued to get electroshock for quite a while. She had at least 31 we know of. And it left her in a debilitated, disabled, confused, disoriented, frightened position with severe memory loss around the incidences, around the events, around the period prior to the event, and severe and important learning disabilities or cognitive dysfunctions that affect her life today. 47 years without psychiatry, within 2 years on permanent disability, and 7 different drugs, she said. What else do I want to say about that? During the ECT series, you heard Evelyn. She'd get a series, and then she'd have another meltdown, and then another series. How long can this go on? There's no accountability. There's no ethics. There's no real disease in the first place. The treatments are not healing or curative of anything. The drugs will cause damage gradually over time. The electroshock causes immediate, overt brain damage, which is cumulative. Fortunately, the human spirit is incredibly resilient. You've seen an incredibly resilient woman, Evelyn, to go through what she went through. And she will get better, even though she will have some severe hurts and losses that are irretrievable and irredeemable. Informed consent? No. It ain't going to happen around electroshock. There is no legitimate medical value for electroshock treatment. There's no legitimate reason to brain damage someone who's not already brain damaged, who doesn't have a real disease. There's no legitimate reason to induce grand mal convulsions in people and cause more damage. Let's stop it. The Coalition for the Abolition of Electroshock in Texas. Endofshock.com. Seton Shoal Creek, you need to stop what you're doing. St. David's Hospital, you need to stop what you're doing. Hospitals and psychiatrists all over this country and around the world. Maybe 100,000 people a year in the United States, many more around the world, are being brain damaged and assaulted with electroshock. Our community of Austin, Texas, is going to become a shock-free zone. Help us out, Shoal Creek Hospital. Help us out, St. David's Hospital. Get a real medical wellness program there, and we'll support you. But the electroshock is going to stop.